Good. All right, so we're going to get started here. Let me minimize this. So, my name is Jennifer Christophel. I am a certified muscle activation technique specialist. And I also have done some webinars for different EDS groups, including the EDS Wellness Group, on topics of other interest, EDS, Pilates for EDS bodies, and good posture and things like that. But today I wanted to talk about muscle activation techniques. This is something that's actually been out there for a long time, but more and more people are hearing about it or experiencing someone that has had some experience with it, or maybe they have had experience with it. So, and I know it's kind of weird because I can't see myself talk. So, again, every now and then I'm going to come up here and just make sure there's no chats. I'm trying to, for privacy's sake, keep your videos off. Okay. And now and then, if I pull it up, if you just don't want to be seen, please just turn your video off. You have that ability, and I'm not offended by it. It's totally fine. So, I'm going to tell you a little bit about myself, only because most of you do have no idea who I am. So some of you may know me as the Pilates instructor in the area. I work a lot with the EDS community. And I have done webinars in the past on that, and they're kind of out and about somewhere. But as you can see, I have lots of crazy credentials. But it's really been because I have a passion over my lifetime. I've been doing this for about 22 years. And I really have a passion for helping people. It all kind of started, like a lot of you, as a child. It was one of those kids that had just the weird things going on all the time. I always bruised easily. I was diagnosed with TMJ early. I had the terrible growing pains in the narrow palate. I had that awful palate expander as a child. And as I was, aging through my adolescent years into adulthood, just dealing with always the weird stuff. I started in a ballet background, but I was always the one that was injuring my tendons and tendonitis and dislocating ribs all the time and dealing with costochondritis. And it was just always something. But if nothing else, it built a really, I guess you could say it built to empathy and compassion into me in a way that maybe I couldn't have understood as well if I hadn't been dealing with chronic pain and injuries. And as a 19-year-old ballet dancer, I was trying to find a way to help my body so that it was stronger and not so injury prone. So I was introduced to the world of Pilates that way, and actually was gearing to be teaching ballet and dancing as a professional, and got more and more into fitness. And then over the years, I did turn pro as a professional ballroom dancer, and that was a very large part of my life for many, many years. But little by little, I started as a Pilates teacher, and I kept moving on, trying to find modalities that would help my clients, because for some reason it seemed like always ended up working with clients with problems. Not that we're problematic people, but it's just they had special populations. Like, they weren't just the average 21-year-old who wanted to get in shape and lose a few pounds. And so it just seemed like I not only had a heart for that, but it just kind of ended up being through need and through demographics what I started working with. And it wasn't until a couple years ago I was diagnosed with joint hypermobility syndrome, now HSD. I think it was 2014. When the new criteria came out in 2017, it changed to HEDS. But I really did not work with this population so much until around 2000. I guess it was more 2014, 2015. And I am going to just make sure everybody, oh, good. There's a way I can just see me. Perfect. So I can tell I'm talking into the camera. Whoops, there came back everybody. I'm so sorry. I don't know how to get rid of that. It's so weird. I do want to be able to see myself a little bit. So I'm just going to pull that down. Nope. Oh, well. Do you mind being seen? I hope everybody's okay with that. If not, turn your video off. It's just very strange to be talking and not see myself. I have no idea where to look. So anyways, being said, through my own journey of trying to be well and helping others, I kept ending up working with hypermobile bodies and EDS bodies. And I didn't mean to do that. I guess it was just because of my background and my drive towards it, knowing what it felt like and what people were dealing with. Probably not so extreme as some of you, but in a small way. And I just kept looking and seeking for ways to help bodies that dealt with chronic pain and inflammation. Also, my mom deals with that and has had a lot of problems over her life. And then through this kind of stage of about 5 to 6 years, I was um, exposed to muscle activation techniques. And at first, I thought it was, I didn't know what it was actually until I actually explored it a little further because one of my EDS clients had experienced it and had tremendous results for it. So I decided to look into it and experience it myself. And it was really quite amazing. And I felt like it was the missing link. For so often, I had been working with bodies that I could see the compensations. I knew they were dealing with chronic pain, but no matter, I did all the right things and everything that I should be, and they were doing all their exercises, and it just seemed like there was it was repetitive. They kept coming back with the same kind of pain and the same kind of issues. Maybe it would get better, but it was like we knew that, say, their glute max on the left wasn't firing well, and because of it their psoas was overactive. I'm sure you've all heard stuff like that before, but no matter what we did to fire that glute max, it's just the psoas kept overfiring and or being too tight. And it was like, okay, there's got to be something missing. And it was through my experience with muscle activation techniques that I really started to understand, ah, we can ask a muscle fiber, a muscle group to fire, and we can ask certain muscles to be prime movers when we move a joint. But if they're not neurologically connected or working properly, they're not going to fire on demand when they should. And then other muscles will continually take over. So, those muscles that were so tight all the time that, as a corrective exercise specialist, or if you've ever worked with PTs, or we're always trying to focus on the pain in the area of restriction. But suddenly muscle activation techniques gave me a different perspective of maybe it's not the muscle that's tight and restrictive and in pain that's actually the problem. It's sometimes a muscle that crosses that same axis that's the problem, that's not firing correctly. And because of that, that upper trap or that psoas or the SEMs or whatever it is just will not let go because it's guarding. How many of you have heard of guarding before? Muscles that guard. It's like the main thing inflammatory disorders and hypermobile bodies deal with. So we could get rid of that guarding for a while, but like 80% of the time it kept coming back. So that's what got me most interested in muscle activation techniques, because it was kind of that missing link inside of things like, this is why this might be happening. I'm not saying it's the solution to all problems. I'm not saying that you need MAT for everything. I'm just saying it's another way to look at a situation and treat a muscle group that could really be the epiphany for the body. So that's kind of my experience and how I got into it. Last year, I completed a 12-month certificate degree program in it. And it's really quite amazing to actually start putting it out there. And the more I talk to people about it, everybody kept saying the same thing. What is it? Even the physical therapists I work with here, they're like, we've heard of it. We've heard that it works. We really just can't figure it. Like, what is it? How does it work? So I thought, okay, let me just do a short webinar to explain to you what it is and how it works. And from there, you can make your own decisions, but at least you know what it is. And it might be something that could help some of you, like it's helped me and it's helped a lot of my other clients in the past and present. Because remember, in the past, I was always sending them out. Now it's wonderful that I can send them out to whatever demographics best for them or area they live in, or that, I can work with them if they work with me. Okay, so let's move on. I'm going to try to keep this short as possible. What is it? Okay, we call it MAT because muscle activation techniques is kind of a long name. But it's a muscular assessment tool that analyzes and then corrects muscular imbalances. So what you have to remember is that this is not something you just do on your own. MAT practitioners do give homework based on what they've treated you with or what area they focused on, but it's a program of assessment and treatment by the practitioner. Now, there are some isometric things that are very similar to what we do that we give people for homework, but it is a modality of treatment and it focuses on the cause of pain, not the pain itself. Okay. And we do that by texting, correcting, and then helping you through homework maintain muscle contractile efficiency. It's based on the principle that flexibility is a derivative of strength and that muscle tightness is secondary to muscle weakness, which we're going to get into a little bit more. I know for some of you, you're like, what? That doesn't make any sense. But it's the muscle tightness, pain, and restriction as an MAT practitioner that guides us down the path to where their root problem is. Does that make sense? It's a little easier way to understand it. So we don't immediately, sometimes we do, and this is me typical of the past, is like I look at the tightness and pain and I want to zone in on that. We go around that to find the root cause, right? So a tree that has a branch that's not working and not swaying in the breeze, sometimes you don't want to look at the end of the branch, you want to look down in the trunk, somewhere around or around the branch where the branch attaches to the tree. So we'll talk a little bit more about that in a minute. There is this really great video that I do want to play. It's through YouTube, and I'm moving on here. Keep clicking. I love that video, so I wanted to use it for just for a little bit of quick kind of bam, this is what it is. And we're going to talk about a little bit more about it and how it can especially help those with EDS. So with EDS, I'm kind of targeting, or not targeting, I'm talking to this community because this is something that I have a heart for, and I have seen so much success with it, but it's really for everybody. So whether if you're looking for MAT treatment, or if you're a health professional looking for, maybe a way to integrate this into your practice, because I think some of you out there are professionals that are watching this, it doesn't matter. Everybody deals with chronic pain and restricted movement. And one of the things that I have seen over and over again is that hypermobile bodies deal most frequently with some of the most tight and guarding muscles. So just because there's soft tissue laxity and ligament and tendon laxity does not mean that you're not going to be dealing with shift camera view, screen sharing. Oh, some of you couldn't see the video. Oh my goodness. Well, that didn't work if you guys didn't see the video, but maybe you could hear it. We'll talk about it more. I'm so sorry. I don't have, like I said, I don't have a co-host, so I'm kind of dealing with this all my own today. But one of the most important things I want to talk about is how we help to reduce pain, chronic pain, with MAT. Like I said, I'm not saying it's the key to everything and the solution to everything, but range of motion, whether it's tightness in the back of your neck or upper traps or SCMs or hamstrings, determines for the MAT practitioner what muscles might be inhibited. So when your range of motion is limited and muscles are tight, it's a sign of muscular related weakness somewhere in one of the muscles, or one or two of the muscles that cross that joint axis. So MAT practitioners use that joint restriction and that muscle tightness and guarding to help predict what muscles are potentially weak. So, and what happens is over time, the muscular system creates different amounts of tightness around joints. So even though you're hypermobile, dealing with pain and trigger points and muscles that are compensating and guarding for other ones that aren't working is a very, very common problem with hypermobile bodies and EDS bodies. So for instance, I'm giving you an example. How many of you, when you squat down to pick a book off the floor, maybe feel a pain in your back? Or you go to turn your head and you feel the pain in the side of your neck. And these are the kind of indications that are telling you that, okay, look, there are some muscles that are guarding and tight and pulling down and causing, inflammation and sometimes nerve pain. And you're feeling that due to that restriction and that guarding and that tightness, when really the pain is a problem or symptom of compensation. So, and we can't really tell what that is by just watching someone for years, always with teaching Pilates. Like I was always looking at what I thought the problem was in the tightness. And then I started to really learn on how just because that area is producing the pain and I'm seeing a tightness, again, it's not always usually the area of problems or the area that's causing the compensation. So MAT is a modality that's not like other therapies because we don't treat the pain and tightness directly by using stretching, dry needler, massage. Those are Those are modalities for the physical therapist or the osteopath or the doctor. And MAT practitioners work really, really well with that because sometimes we do need the stretching gently in the right way, especially for EDS bodies. And sometimes we do need the dry needling for those areas that we just cannot get rid of that pain inflammation in. But we also need to remember that that's not going to get rid of the root problem, right? Because how many of you have had dry needling massage or done some gentle stretching on areas that are constantly tight and hurting, but it always comes back? So MAT is the modality that treats, whoops, here I have to, how do I move this here? There we go. Oh, whoops. Oh, I just closed it. Oh dear, I hope she comes back on again. So it treats the, there we go. It's going to be treating the muscular dysfunction because it's a neurological disorder, which we're going to get into in a minute. So as you saw in the video, for those of you that saw or didn't see, the MAT approach uses a system of evaluations. They're called comparative assessment of mobility exams, where we go through and we check the range of motion in the areas of tightness around the joints and in the body on that person. That then guides us to the area that has the most or the biggest issue that we need to focus on at first. And sometimes the pain will be on the left, but the biggest restriction's on the right. And people are like, well, why are you looking at the left? But we're looking at where the restriction is because that leads us to where the weakness is. And then by using digital manipulation means palpation of the muscle fibers at the insertion and origin of the muscles, thereby getting it to fire. And then we do a muscle test to train the muscle to connect. And we're going to talk about that in a minute. But it's like trying to start a car without a battery. So we're trying to get that battery turned on so the car runs, because so often with inflammation and hypermobility, the little batteries in the muscles get turned off, and we're going to talk about that here in just a second. Also, it's important to know that MAT is an isolate-based technique. So similar to the way mechanics work on cars, we examine the body in stasis as an integrated system, but then we're trying to isolate where the dysfunction is. So we're not interested in what you can do, we're interested in what you can't do. What range of motion is not happening? What that's leading us to the muscles that are not contracting properly, that are allowing that joint action to happen. And then because of it, other muscles are staying tight. And that's what we're going to talk about next. So what is the science behind MAT? So first of all, it's important to know why we would maybe need this. You know, whose muscles maybe will not lose their contractile efficiency, or what type of body creates more compensations in it than others. Well, athletes, because of repetitive stress syndrome, systemic disorders, and clinical inflammation. So as we know with hypermobility, there's often an increase in inflammation. In fact, I know it's pretty common for one of the comorbidities of EDS is chronic fatigue and fibromyalgia. Widespread inflammation, trigger points. And because of that inflammation in the body, and because of that soft tissue laxity, what happens is there's a breakdown in what's called the muscle's gamma loop. We'll talk about that briefly in a second, but what that breakdown in the loop does is creates muscle inhibition. The muscle loses the ability to tolerate loads, forces, and stresses on them, and it also doesn't fire on demand when asked to fire. Now, obviously, we know we need the ability to be able to have proper muscle function for joint stability, right? We have muscles that stabilize joints. We have muscles that move joints. When prime movers are not working well, small intrinsic muscles start to take over. And that's actually when we see the most pain and inflammation and trauma to joints, is when the small intrinsics are trying to take over for big movers. And of course, that can go the other way too. But the important thing to remember is that if a muscle has lost its neurological connection to fire on demand, other muscles that don't have that lack or loss of neurological function will take over. And that's what leads to compensations. And that's what ultimately leads to more pain and more inflammation. So if everybody were to, and here I'm going to put this on here, if your camera is on, right, and you're here, and you were to like flex your bicep, even if it's small, right? You don't have to have big guns. You can feel your biceps. When this muscle contracts, what's happening on the opposite side of the arm? It has to lengthen, right? When this side contracts, the opposite set of muscles, and there's more than just the biceps here, there's lots of stuff that's helping. The other side has to lengthen. So it contracts and lengthens, and it should happen at the same time. That's the law of reciprocal inhibition. And every joint in the body has a group of muscles that needs to be contracting on demand. You can put your arms down, by the way, and muscles that, yeah, you're going to end up with another pain and inflammation issue caused by my webinar. So, um, and then it has muscles that need to lengthen. So oftentimes we're focused on, oh, this one's not lengthening, this one's not lengthening, but it's because this one's not contracting, right? So if the signal for this one does not contract, this muscle group is never going to get the signal to elongate. And that's what we're going to talk about right now. So if we go to we're going to talk a little bit about inflammation just real quick, because I know that we all deal with pain and inflammation at certain points of our lives, or maybe every day. And what does inflammation do, and why would maybe MAT help it? So quickly, inflammation causes sympathetic hyperactivity, leading to vasoconstriction. It decreases your blood flow. It decreases the oxygen delivery to the ATP synthase, which means it's your food energy to the mitochondrial cells, right? And when muscles become more inflamed and they have less oxygen, they become less capable of handling physical loads. Their tolerance is lower. The slow twitch fibers are negatively impacted and lose their oxidative capacity, which means that they lose their endurance, right? So we have slow twitch and fast twitch fibers, okay? The slow twitch fibers are the ones that give you endurance, so that you can go throughout your day and your muscles are always responding and contracting well and going on and on. Your fast twitch fibers contract fast, but they wear out really fast, right? And what's interesting is the Mayo Clinic research has definitely shown that inflammation, such as chronic fatigue and fibromyalgia, cause bodies to become very fast twitch dominant, right? So they're getting a fast contraction, but then they can't tolerate the force load. And that's why a lot of hypermobile bodies have trouble with working out, because it's like we want to get stronger, but we don't know where that stopping point is, where we're not going to injure ourselves, because our muscles kind of give out with the ability to continue to contract and hold that endurance of that ability to continually contract and on demand, and not over contract and then give out. And obviously, as a result, we fatigue faster. Our threshold activation is higher, which means that we can't handle as much force load on the body. And that could just be walking up and down the stairs. It could be holding your head up in front of the computer. It could be stretching a band or using weights. It's just more the fact that the threshold of being able to contract and handle stress and force is very low compared to a muscle group that's higher, has more oxidative capacity. Also, we lose our lack of proprioception and sensory input with inflammation, which is a big problem, right? With EDS, is that that proprioceptive response and knowing where our arm is in space and how to move it. I know it sounds crazy, but it's true. I think it's hilarious how so many dancers are great at dancing because they're, hypermobile, but it's like we have some of the most problems with proprioception too. So it kind of is interesting. So anyways, and then also our muscles lose the ability for timing. Whoops, let me go ahead and let all these people in, more people. Okay, so moving on here. Sorry if I was late to let some of you in. I'm just trying to talk quickly here because I know we're already at 30 minutes. So I talked about this law of reciprocal inhibition and this neurological loop. And for those of you that like science, you'll like this. If you don't like science, have a cup of tea and sip on the tea for a moment. But some of us really like science, and I think it's important to understand why you would want to entertain the thought of a different modality, because you have to understand how it works and why it works if you're going to want to think that it does work, right? So we talked about how inflammation and pain can break down the gamma loop, right, of the muscle. And this is the feedback loop in our nervous system that regulates the level of tension in our muscles. So we talked about that reciprocal inhibition And so the gamma loop is what this one, the muscle says, I need to contract. It goes to the brain, and the brain says, you need to lengthen in order for this one to contract. And that's kind of a layman's term, simple way of the explaining the gamma loop, right? Um, Now, the gamma loop is based on muscle spindles, all right, and activation of muscle spindles. And these are sensory receptors known as what? Proprioceptors. We talked about proprioception, how that gets broken down with pain and inflammation. And as we all know, proprioception is how we sense where our body is in space. And it helps our brain to know the position of our body and gives us feedback on the length of our muscles and where it should go, and how far to contract and how much to lengthen. Now, these muscle spindles are located in our skeletal muscles, and they detect changes in the length of our muscles. And for this reason, that's why we call them stretch receptors. So remember, a little while back, I was talking about how MAT practitioners stimulate the muscle spindles in the skeletal muscles before we do the muscle test. That's because we're trying to get those muscle spindles firing, and then we fire the muscle in that position to get that gamma loop connected. It's like having a short in a wire, and we're trying to repair that little short in the wire so that the light turns on. Okay, so it's kind of, if you like to learn about, if you're real sciencey and you want to learn about the gamma motor neurons and all that, I can send you this slide. I don't want to go too much into it. Just know that MAT is based on a very neurological basis and perspective of the muscle. Okay, so many times we're focused, like I said, on that area and that muscle. It's like, okay, we know this muscle needs to fire so that the SEM doesn't overwork. But we're so focused on that SEM, we're not looking at maybe the other muscles that aren't firing well, and that breakdown in the neurological loop that continually makes us to keep guarding and being tight through those SEMs. I'm just giving you an example. So I just left this up here for a moment if you want to take a screenshot, or I can send it to you. I love science, so I'm one of those that loves to present this a little bit. But it really is amazing once you start to learn your body and how it actually works. It makes more sense on maybe why something isn't working. So if you look at the picture of the quadriceps, right? The quadriceps give that loop starts. It needs to contract, but then what needs to elongate? The hamstring, right? Now, if that in MAT, we talk and address the quadricep that's not contracting. And because the quadricep's not contracting, the hamstring never gets the communication from the brain to elongate and let go. Okay. So, and that's just an example because it's very easy to think of the top and bottom of the leg, but it can be in any muscle that goes around the joint axis. So it's pretty complicated from an MAT perspective, as far as it's not just, oh, the hamstring's tight, we need to look at the quad. Well, no, it could be about 25 different muscles around that joint axis that we need to look at. Now, we're not going to treat them all, but we use our system of evaluation to find those muscles and then palpate and muscle test and create isometrics. Okay, so quickly, what does muscle activations not do? Because I think this is as important as what it does do. It does not directly address pain, although it can indirectly affect it. So remember, my pain is here. We're not going to go immediately look here. We're looking at maybe the muscles that side bend or different joint axes, and we're going to be looking for the muscle that's not contracting well. So this one's guarding and holding. So we're not addressing the pain of the SAM. We're addressing around it. The SAM pain may go away. That's our goal, obviously. But just know that we're not going to always be directly going to the area where you're like, this hurts, fix it. We don't fix things. Okay, we help your body fix itself. It's not a quick fix. Sometimes people get wonderful results in one treatment. Sometimes it takes 6. It's not a therapy. We are not a replacement for physical therapy. It is an adjunct to physical therapy. Physical therapy is usually a must, and corrective exercise, but it's an adjunct to it to help you get the most out of all your family of modalities. It's not subjective, it's objective. So we're not gonna, if one gait analysis or PT or corrective exercise specialist watched a person walk across the floor for gait evaluation, All three evaluators are going to see different things. It's not subjective. We're not using our eyes. We use a system of assessment and muscle testing. So it's not, oh, you have tight hamstrings. This is probably the reason. No, it's a system of evaluation and then treatment. And it's not an answer, it's a question. We go, okay, you have pain here, it's tight here. Why? Let's figure it out. And then, MAT, like I said, is not all these different modalities. It is an adjunct to it. It's not the only thing I do. You can see my business card. I do lots of things, a lot of Pilates. I'm in massage school right now. I'll be graduating in March, becoming a massage therapist. I use lots of modalities. MET is just one of them that's like that little missing link in there. For me, anyways, and how I've seen it, it might be that for you, or it could be that for you. So, quickly, it doesn't show results in the short term. Remember, it's not a quick fix. I know everybody wants to come in and say, I have this problem, fix it. I have had people come to me and say, I have, I have knee pain. I want you to come, you have one time to fix it. It's like, oh dear. Can you imagine going to your physical therapist and saying you have one time that you can fix this problem? Well, sometimes we have to explore, and sometimes it takes a little bit for the threshold of the muscles to keep ramping up. It depends on how long you've had the inflammation. If there's anything that you do in your everyday life that's a repetitive stress to that, sometimes that delays the process a little bit. Sometimes age. I've noticed that I just worked on a 16-year-old. He had a terrible shoulder injury for 3 years, couldn't figure it out. One MAT session, bam, he's fine. That is not the norm. But he also was 16, so I'm sure youth had something to do with it. But it's a part of your holistic treatment plan, or it can be. And for people that have kind of a plan of treatment in MAT, and maybe once a week for a few weeks, every other week for a few weeks, and then really it should be a matter of just tuning up, right? When if you start to experience this problem again, either through suddenly about a flare. I don't know about you, but I have times in my life where I go into a flare and I'm much worse, or something I've been doing has created a lot of inflammation, and maybe that has broken down that long-term issue of the gamma loop, and I need to have that area treated again. So MAT is something that should be kind of something like like I said, a car mechanic. You're not going to buy a car and then never have it taken care of. You're going to get the oil changed once a year, and you're going to get new tires every now and then. So although MAT sometimes starts out as more of a targeted modality, it usually just ends up being a maintenance modality, something that you would use or have you be treated with just periodically or when necessary. So how can it help hypermobile bodies and EDS? Well, what is the prime, well, I shouldn't say prime goal, but what is one of the primary goals we have with hypermobility? To build stability in the body so the body can move and do hobbies or your job without injury. So because soft tissue laxity and chronic inflammation continually is breaking down that gamma loop that gives the signal for the body to contract on demand, and thereby creating other compensations and guarding, usually that type of body, along with athletes, right? It's interesting because I actually, believe it or not, think like a body with EDS is addressed the same as the premier athlete. It's just that your body deals with inflammation and pain due to a different reason than the pro athlete, but both tend to need more maintenance, right, than the individual that doesn't have soft tissue laxity and chronic inflammation. Does that make sense? So just think you're like a pro athlete. So but what you have to remember is that there's a need for muscle maintenance. We need the ability to be able to contract on demand. We need to be able to have a good threshold for load. Like I said, whether it's walking up and down the stairs, or whether it's doing the Pilates leg circles on the reformer, or if it's being able to go for a walk with your dog, right? And the dog is pulling on your arm. Does the arm have the ability to contract properly on demand with the right type of muscles? And some muscles need to elongate and others need to contract so that it doesn't pull on the tendons and ligaments and soft tissue. instead, right? That's where we have a problem. So the goal for MAT is to make people be able to live life and do whatever they want to do or love to do without injury and without pain. But again, it is not a replacement for other modalities. It's adjunct. It's something to help you do all the other things you're already doing better, and to be able to do that bridge and strengthen that glute, and that glute's now firing, right? Instead of doing it over and over again and still dealing always with that SI joint dysfunction because the glute or whatever muscle is not working well for you. Okay. We've had lots of wonderful feedback. There are MAT specialists out there. I'm not the only one. I'm just trying to present it to you, having a heart for hypermobility and EDS. But you know, I have yet to meet someone who's had a bad experience with it. We'll hope that never happens. Although it does happen. I mean, sometimes we have that with doctors and physical therapists. It always happens. But I just want to encourage you to explore the concepts that, maybe I need to start thinking about my body in a little bit more scientific, neurological way in order to get the most of all my other modalities or my exercise. And so